Hi there. So it's Breast Cancer Awareness Month, and we're talking about different things to be aware of. What can you be aware of if your friend or someone you know or love has been diagnosed with cancer? What are some things that you should not say to your person, and things that you should say instead, things that will be more helpful, keeping in mind that every person is different and not every rule is going to apply to every person. But let's just jump right on in. These are going to be things that some of you may have heard, some of you may have said. Don't feel guilty if you've said some of these things, because you learn and then you do new things, right? So here's a comment that you don't want to say. You don't want to say, oh, my aunt, uncle, brother, sister, friend, cat had that same cancer. I know it may feel like you're just trying to be supportive and you're trying to be connected to that person, but when we've just been diagnosed with cancer, we're pretty consumed with the reality that is our life. We really don't want to hear about this random person that we don't know. It doesn't feel secure. And if you dare to follow that sentence up with, they died, but I know you'll be okay, just don't. All that says to us is a reminder of something we've already been struggling with, which is the fear that we'll die from this cancer. So no comments about other people, and absolutely no comments about someone who died. Instead, this is a time where you just want to be with your person. I am so sorry this is happening to you. Please help me know help me know more about what you're going through. Please help me to know the way that you're going to be treated. I want to be there for you. The focus on the person. Another one, and this is sort of similar. And so many of us have said this, if you've said it, don't feel too bad, but I'm going to give you a better way. So many of us want to say, if there's anything I can do, anything at all, anything, you can call me. Please let me know if there's anything I can do. I want to be there. Okay, so the problem with this is, this leaves the onus, the pressure, the responsibility on the sick person to do the calling. And to be honest, don't all of us really hate to call and ask for help? So what you're doing by that comment, and I know you meant it to be kind, but what you're doing is you're taking the pressure of asking for help and you're putting it on the person who at that point in time is going through probably the most difficult situation that they've ever faced in their life. So while you're facing a difficult one, let me just put something else on you. See, it doesn't help really. A much, much, much better way, if you want to be helpful, is to be in the moment and think about specific ways and specific times that you can help. It would look something like this. Texting to say, hey friend, I'm headed to the grocery today. Can I pick anything up for you while I'm there? And send it. Or I'm going to be out in town today or this weekend. Is there anything I can pick up and bring for you? Or I'm going to be taking my kids this weekend to some event. Could I pick up your children and take them along? Or I really want to bring you and your family some dinner. I'd like to bring it this week. Is there a day this week that would be better? I'd like to bring Tuesday or Thursday. Would one of those days, or is there another day that would be better? And by the way, is there anything that someone in your household doesn't eat? It's much easier to say to someone, we don't need anything, thank you though, than to scrounge around in your kitchen and be really exhausted and think, well, I'll just call and ask someone, because you just won't. They just won't. So there's that other one. Here's one. You're so strong. I know you're going to have this. You're going to fight this and you're going to win. Lots of people have fought it. They've won. You're going to fight it too. You're so strong. I know you can do this. I know you're trying to sound like a cheerleader and you're trying to be peppy and you're trying to be encouraging. And for a moment, that can, especially at the beginning, that might feel a little bit encouraging and uplifting. But the problem is, I've never known anybody who went through a cancer journey that didn't hit some spots during treatment that they didn't feel strong, that it was all they could do to get to the bathroom to throw up, or it was all they could do to get down to the kitchen and just get in their mouth a little bit of cottage cheese before they're back in the bed. And in those moments, cancer patients don't feel strong. In fact, most of the time they don't feel strong. And when they're having those we are having those really weak moments, it can feel very much like everybody else has the expectation that we stay strong. And now I mustn't let them down. And so now it's not about me taking care of me during my cancer treatment. It's about me taking care of me while appearing strong for you. It puts extra pressure on the person. So a much better word to use if you find yourself wanting to tell someone that they're strong, or you're seeing that they're strong, a much better word to use is to tell them that you can tell they are handling this with such grace. Because grace leaves room. It leaves room to be big and bold and get out there and make the changes. It also leaves room to be sick and laying in the bed and you can't get up. You can still be graceful in either of those moments. And that doesn't leave a backhanded push that we don't realize. And I know that you wouldn't mean to be doing that, but it can happen that way. Oh, here's one. I can't believe this happened. I can't stop crying. I've been worrying about you for the last 2 weeks. This is just making me sick. Oh, good. Now I'm responsible for another person having a sleepless night. Oh, yeah, don't. Just don't. This actually, their cancer isn't about you. Their cancer is about them. So if you want to talk feelings, lean into their feelings, not yours. And leaning into their feelings is, oh, this has got to be so difficult. It's in ways that I can't even imagine. Please help me to understand better what you're going through. You see how that's more about them and not about me and how I feel bad. A challenge in all of this is that we as a society generally are not very comfortable being with other people when they are uncomfortable. The challenge is, can we learn to be comfortable in our friends' discomfort? Can we sit with them and let them be miserable and let them be in pain without trying to somehow talk them out of it? This is a fun one. A fun one not to say. Just be grateful or I'm so glad that it's not another kind of cancer. I'm so glad, because there's always one that's worse, right? So just be glad it's not that. I promise you, never in the history of cancer has any person been grateful for their specific cancer, and you can't talk them into it, and nor should you try. So if you're saying to them, just be grateful it's not a different kind, what you're saying is you're minimizing the stress that they're dealing with. You're minimizing the angst and the grief that they have to work through with this diagnosis. Again, be there for them. I don't care if they have a tiny little stage 0 cancer that is going to zip right on out and should, with a minimum of treatment and a minimum of post issues down the road. Just remember that when you're being light about at least it's not that other kind, at least they caught it stage 0 and not stage 4, just remember that a fairly large, in comparison, number of cancers, metastatic cancers, particularly breast cancer, comes for someone that had an early stage cancer. So an early stage cancer is not a guarantee that we won't end up with a metastatic situation. And cancer patients know that. So please don't put us in a position of needing to now explain to you the facts of cancer. That puts, again, more pressure on the patient. So no comments about at least it's not. Believe me, it's big and bad enough for that person. So again, the thing to say is be with your person in their moment. Oh man, this really sucks. I'm sorry. I know this is not what you ever dreamed of. How can I be here for you? How can I understand better what you're going through? Good comment for that one. Always wanting to know how you can better understand what someone's going for. Please do not ever say to someone who has had breast cancer, at least you're going to get a set of new boobs, because I'm going to tell you what, there's not a one of us that wants new boobs that way. And before we get into this world of breast cancer, we have an idea that getting implants or getting new boobs is a fairly simple procedure. It's not. It is such a difficult procedure that more than half of the women who have mastectomy choose not to do it for multitudes of reasons, but one being that it's a pretty major surgery to have. And the complications can be quite large. And if you've had certain types of reconstruction, your boobs, your breasts have zero feeling in them. There's not many women on the planet who are really okay with that. So we're not glad about boob jobs. If we wanted a boob job, we would have gone to get one before. So please don't minimize what your breast cancer person is going through by telling him at least anything. Anything that follows the at least is a bad thing to say. And you want to still go back to being with your person in the moment. I know this is not what you wanted or expected. I'm sorry, so sorry about this for you. Help me understand what this is like. Please help me to know so that I can support you better. Don't ever say to someone, I know how you feel, because even if you have the exact same cancer and your life circumstances are exactly the same as far as married, 2.5 children, live in a house with a picket fence, or whatever your life may be, you still don't know exactly how that person feels. And people, the patients, we know that. So when we hear, I know exactly how you feel, an awful lot of the times what we think of is, no, you don't. You're not exactly in my shoes. You don't know how bad it is for me. So again, you want to lean into what is the experience like for the person in front of me. This is about them. It's not about my understanding. It's about the person in front of me. Another one is oh, I just read an article about artichokes cure cancer. We get that all the time. And if your person is in the process of researching and trying to learn about some homeopathic things, about some additional treatments to what they're getting, if they're in that path, then please feel free, reach out and be a part of that journey for them. But if they are having traditional treatment, they do not need to hear that vitamin C kills cancer. If they are sick for months from major treatment that research shows gives them the best chance at life. And in the case of inflammatory breast cancer, they are having 5 to 6 months worth of treatment. If they're stage 3 and not stage 4, they're having a mastectomy, and then they're having radiation. To hear that someone thinks they could have solved all of this by having some extra vitamin C or carrots, it is not comforting. So again, if you're interested in the treatment of the person that you're with, ask them about their treatment. Can you help me understand, teach me what treatment looks like for this kind of cancer? How is it different from other kind of cancers? Do you have any idea? Is there any way that I can support you? How can I help you make it through some of the worst of the side effects, if there are side effects? Are you comfortable with your physician? You may want to encourage your person to get a second opinion if they haven't had one, or if they're uncomfortable with their physician or their treatment. But if they're satisfied, they're happy, and they're moving forward, this is not the time for you to throw out what you read in the latest blog about cancer. One of my least favorite, and I am so intent on this, and this has been the final one, but please don't say about your person who dies following a fight with cancer, please do not say that they lost their battle with cancer. Because I will tell you, winning a battle with cancer looks like living with cancer. It looks like when getting up and doing what you can during that day. If it's only getting up and walking to the mailbox, if it's only sitting on the side of your bed or sitting on your bed beside your child and letting your child read you a story while you try to stay present, but you're so sick it's hard to, or your mind from the chemo makes it so difficult for you to stay focused, still sitting there is winning the battle with cancer. So, and for a personal example, I had cancer starting in 2016, was treated 2016, 2017, now we're in 2023. So for these years, I have either been in treatment or been in now preventative moving forward. But I'm getting up and I'm going to work when I can. I'm living a full life when I can. And if this cancer comes back and someone says about me that I lost my battle with cancer, well, first of all, I'm gonna come back and haunt you. I've told the people around me that. I will haunt you if you say that about me, because I'm not losing my battle with cancer if I live every day that I have while I have cancer, even if it means just sitting and reading or just smiling at the nurse, because that's all I can do. That is being successful. That is living successfully with cancer, living with what we have to the best of our ability. We do not lose our battle if we live that way. So if your person does not survive their journey with cancer, if they do not survive this disease, they're going to die of something. We're all going to die of something. So can we say so-and-so died? Yes, they died. That's the statement, they died. Oh, how did they die? Oh, well, they did have cancer. We wouldn't say a person lost their battle with heart disease. They lost their battle with dementia. They lost their battle with accidents. They lost their battle with the car. They tripped and they fell and they lost their battle with the sidewalk. We wouldn't say that. But somehow we throw the losing onto the patient with cancer. And so please don't do that to the person that you love who has cancer. Please honor their life and honor what they have done. Honor the life and honor the way that they dealt with cancer, however it is that they did it. Thanks and so much. We'll see you again another day this month. Bye-bye.